It's fall, and you know what that means. Not quite that. It's open enrollment season. With that comes questions about the Health Savings Account, or HSA. A health savings account is a tax advantaged way to save money for qualified medical expenses. Funds can be invested and grow for the future. The key word in health savings account is savings. With a healthcare flexible spending account, or FSA, someone might lose unused funds at the end of each year. Only $610 can be carried over to the next year with the healthcare FSA in 2023. It likely makes sense for someone in that situation to pay for qualifying medical expenses before year end. Employees might also lose funds in their healthcare reimbursement arrangement, or HRA. Employers may cap how much an employee can carry over from year to year. Balances above that limit could be lost forever. Employers might also decide employees forfeit unused HRA funds when they leave the company. Unlike a healthcare flexible spending account and a health reimbursement arrangement, a health savings account is portable. An HSA isn't use it or lose it. Someone who leaves an employer can take their health savings account with them instead of losing it to a corporate version of finders keepers. The funds could also be used right away to pay for qualified medical expenses, though that often isn't the best move. The biggest advantage of a health savings account is the triple tax advantage. It avoids taxes on the front end, grows tax-free, and can be withdrawn tax-free if used for qualified medical expenses. That is, it might allay the tax man altogether. The biggest drawback is that to contribute to an HSA, someone needs to be on a High Deductible Health Plan, or HDHP. That means that if someone has a medical emergency, they may be like an upside-down turtle. A little help here. How much someone must pay out of pocket before the insurance company pays anything, the deductible, must be at least $1,500 for an individual and $3,000 for a family. Fortunately, there's a maximum of $7,500 for individuals and $15,000 for a family. Someone in that situation would pay somewhere between ouch and boing. It's important not to let the tax tail wag the health insurance dog. If the high deductible health plan is the right call without the tax benefits, sign up and then consider contributing to a health savings account. The most that can be contributed to an HSA in 2023 is $3,850 for an individual or $7,750 for a family, which doesn't sound like much until you consider the average American only saves about $5,000 a year total. Those age 55 and wiser can contribute an extra $1,000 with a catch-up contribution. However, once someone goes on Medicare, they can no longer contribute to a health savings account. There's also a cool last month rule for HSAs. In most cases, as long as someone is on a qualifying high deductible plan by December 1st, they can make the full year HSA contribution. Someone who goes on a qualifying plan in November can contribute the full $3,850 as an individual or $7,750 as a family for the year. There's a catch. Of course there's a catch. They would need to stay on the high deductible plan for over a year, specifically through December 31st of the following year. If they left the plan before then, they'd have to pay income taxes plus a 10% penalty. Ah, the government. Friendly most of the time. Good kitty. No clawbacks. Let's take a closer look at the benefits of a health savings account. I already mentioned the triple tax benefits and ability to tap funds right away. Qualified medical expenses need to be for the insured individual, their spouse, or their dependents. Fortunately, the list of qualifying medical expenses is as long as a Christmas list and includes preventative care, insurance premiums, and ongoing expenses. Covered preventative care expenses include physical exams, immunizations, tobacco cessation, weight loss programs, and screening services for cancer, heart disease, mental health, vision, and hearing disorders. Ah, the joys of aging. Covered insurance premiums include long-term insurance premiums and healthcare premiums when on either COBRA or Medicare. Let's run that back. Even though someone can no longer contribute to an HSA once they go on Medicare, they can use the HSA funds to pay Medicare premiums. I'm not saying he's a gold digger. There's also a whole host of covered care expenses: prescription drugs, dental treatments, chiropractic, physical, and speech therapy. Also covered are pregnancy tests, infertility treatments, and, in case somebody wants to go the other way, birth control and vasectomies. Another tax benefit is that unlike most retirement plan contributions, contributions to a health savings account reduce payroll taxes. They're not subject to Medicare, Social Security, and federal unemployment tax. Take that, FICA FUTA. Health savings accounts also don't have an income limit like IRAs do, making HSAs popular with higher income taxpayers. There's not even a requirement to have earned income to contribute to an HSA. Someone who has only investment income, such as an early retiree, might reduce their tax bill by contributing to a health savings account. Let's spelunk that a little further. The Affordable Care Act enabled children to remain on their parents' insurance until they turn 26. Someone can't be a dependent of another taxpayer and contribute to a health savings account. However, an adult child who's moved out of the basement and works full-time might no longer be a dependent. It's about time, Bobby. They might still be on their parents' insurance. This presents an interesting planning opportunity. The parents may be able to contribute $9,750 to their health savings account, the $7,750 family contribution, plus each of their $1,000 catch-ups. The adult child, technically an independent taxpayer on a qualifying family high deductible health plan, may also be able to contribute $7,750 to their health savings account. The parents might even make the contribution for their independent adult child, lowering Bobby's taxes while helping him save for the future. He's going to need it. We already explored the biggest downside of a health savings account, the high deductible. Contributing to an HSA also reduces how much cash is available for everything else. If funding's needed for ongoing expenses or to pay down high interest debt, contributing may not make sense. None of this is financial advice, but pay your bills. Keeping the lights on takes priority. Contributing to a health savings account may not be appropriate for those in lower tax brackets. The cost of locking the money up for years or decades may be higher than the tax savings. Another drawback is that whatever an employer adds to an HSA reduces how much the employee can contribute. Mike is a single 27-year-old. His employer added $1,000 to his HSA. The most he can contribute to the plan in 2023 is therefore $2,850. It's an HSA teeter-totter. That's not how it works for retirement plans, where employer contributions generally don't limit employee contributions. By the way, it's worth checking the employer contribution to the other healthcare plans. A flexible spending account or health reimbursement arrangement might receive more employer contributions. After all, corporate might keep the leftovers. I often suggest people catch money when it's thrown at them. Some employers also have a history which limits how much high-income employees can contribute to a health savings account. There are tests to ensure highly compensated employees aren't the only ones who benefit from these plans. Finally, if someone has a high-deductible health plan, they generally can't have any other health coverage. This is more of an issue for dual-income couples who each have healthcare coverage through work. A health savings account doesn't work quite like a retirement plan. Employer contributions typically don't reduce employee contributions with a 401k, like they do with an HSA. The minimum age for catch-up contributions is 50 for a 401k, and $55 for an HSA. Instead of a 10% penalty for non-qualified withdrawals with a 401k, it's 20% for a health savings account. And instead of being waived at age 59 and a half, as with the 401k, the golden age is 65 for an HSA. Typically, all funds in a 401k can be invested. However, HSA custodians often require a minimum amount of cash, such as $2,000. A participant may only be allowed to invest everything above that limit. The plan would say it's so people can pay their ongoing medical expenses. Then why aren't they paying interest? I want 5%, Steve. This many. Finally, someone on Medicare can continue to save into a 401k. However, that's not the case for an HSA. Sammy cuts us off. Come to think of it, these are all additional cons of the health savings account. Enough of this HSA bashing. Let's end on a high note. A neat feature of the health savings account is that someone doesn't have to submit for reimbursements right away. They can instead save their detailed receipts in a safe digital place and then submit them as needed. Withdrawing money from an HSA is a bit like taking contributions out of a Roth IRA. Just because it can be done doesn't mean it should. Instead, someone could pay for those expenses out of pocket and let the HSA investments grow tax-free for decades. That said, it's nice to have those receipts handy should the need arise. Like when Bobby T-bones a cop. I hope this was helpful for you to better understand HSAs before your open enrollment deadline. For more content, subscribe to the Scale Finance YouTube channel or check out the Insights page on scalefinance.com. Thanks for watching.